Hello and good afternoon, everybody, and thank you for attending today's Lunch and Learn program. Today we will be doing part 3 of a series. We will be talking about creating long-term practice success for nurse practitioner-owned businesses by Barbara Phillips, who is an expert in this field. Today's webinar is being recorded and will be available in the upcoming week on our NP-SAN portal page, and a link to the recording will also be sent to all registrants. Of note, please look in the chat box, and we have sent you the links to the prior 2 parts of this series, part 1 and part 2 by Barbara Phillips, which you can access using that Vimeo link. All participants will be muted throughout the presentation. I encourage you to submit questions during the presentation. Please use the Questions tab on your GoToWebinar control panel, as seen here, to ask your question. It will be relayed to the presenter and it will be answered at the end of the webinar. The slides for today's webinar are available as a handout, which you can also see here via the Handouts pane, and you can download that and in your default web browser at any point. So please do download the slides for the presentation for today. Also, a survey will pop up at the end of the webinar that will be mailed out to you later today. Please take a few minutes to complete that survey to evaluate this particular activity, as your feedback is critical to the ongoing development and presentation of our webinars. And this is just your personal reflections back on today's survey and not CE credit. And at this point, I am going to turn over the slide on CE credit to Joseph from AANP.
Hey guys, Joseph here from the American Association of Nurse Practitioners. Today's webinar is accredited for continuing education credit by AANP. First, let me say that the survey that pops up toward the end of the webinar to evaluate the impact of the webinar on yourself is not part of the CE process. The CE process always occurs on the AANP CE Center. Part of this process requires that you attend at least 55 minutes of today's presentation. So if you attend 55 minutes of today's presentation, you will qualify for CE credit. That requires that you click on the connection link and you view the presentation in real time as the speaker presents their slides. Phone-in only participants do not qualify for CE credit. Once the webinar is complete, you will receive an email from me if you qualify for CE credit within the next day or 2. And part of that email will describe the CE process and what to do on the CE Center to collect your CE credit. If you have any questions in the meantime, you can email me directly at jreyes@aanp.org.
Thank you, Joseph. So a little bit of information here before we get started. I wanted to talk to people about the national investment taking place for quality improvement in the U.S. with the help of our federal government and the organizations who are presenting this content as part of the Transforming Clinical Practice Initiative, which is sponsoring today's presentation. The Transforming Clinical Practice Initiative, or TCPI for short, is CMS's largest ever investment in practice transformation, with an investment of over $700 million over 4 years and an enrollment of 150,000 plus providers across the country. The NNCC, our organization, or the National Nurse-Led Care Consortium, is a membership organization with nurse-led practices on our membership roster. Our mission is to advance nurse-led care through policy, consultation, and programs to reduce health disparities and meet people's primary care and wellness needs. Our partner in this initiative, the American Association for Nurse Practitioners, is the largest full-service national professional membership organization for NPs of all specialties. The AANP is leading the way in advocacy, continuing education, and professional development for over 80,000 members nationally. The NNCC and the AANP agree that this initiative is important to ensure that NPs receive the support they need to remain competitive in a changing healthcare environment. NPs are the future of healthcare in the United States, particularly primary care, and already provide high quality and cost-effective care. This initiative is an opportunity, the TCPI initiative, for NPs to prove that while helping CMS and the broader healthcare community build the evidence based on practice transformation while preparing for value-based reimbursement. At this time, I'd like to turn our presentation over to Barbara Phillips, who will talk to us about creating success in NP practice. Barbara?
Hi, good afternoon, everyone. Let's see. Do I have them now? There we go. Nope. All right. So good afternoon, everyone. I'm Barbara C. Phillips. I am a nurse practitioner, geriatric and family nurse practitioner, and I've started a couple of different practices. And so I'm going to be talking to you today about how to really build your practice up so that it is sustainable in the long term. Now, in terms of disclosures, I am the owner of Nurse Practitioner Business Owner, and you can see a couple of our websites there in full disclosure. So let me go to our objectives. And today I want to talk a little bit about the financial components that you need to look at to make sure that you have some stability in your practice. And I want to talk about some easy to implement marketing tactics because we have to keep people coming in our doors. Compliance is key because compliance is complying with the law, and we want to make sure that our practices are legal and ethical. And one of the things that we don't often talk about is self-care. So I want to just take a moment to talk about that today. Now, as just a little bit of a review, I think it was April of last year, we did part 1 of this series, and we were really trying to answer the question, should you even consider starting a business? And of course, again, that link is available that you can review that webinar if you haven't seen it already. In part 2, we broke down many of the steps that you need to consider when you are starting a practice. And then for today, as I said, we're going to talk about creating long-term financial or long-term success in your practice. So looking at that financial stability, looking at making sure that we are in compliance, that we have patients coming through our door, and self-care. Now, in all 3 of these, there's a lot more that we could certainly be talking about, but in our time, I really want to hit these highlights. So in the financial stability, one of the things that I have seen happen, and it certainly happened to me early on, you're so busy seeing patients that sometimes you don't just stop and take a look at the bigger picture, which is really what we need to do. So many people, and yesterday this was a topic that we talked about in a workshop that I did, but we tend to want to take just a look at what's in our bank account and our bank balance when we are doing business, and that is not going to help you. You really need to take a look at whatever accounting software you're using, either with yourself or with your accountant, and start looking at your reports. Primarily, you want to look at a profit and loss. You want to look at the cash flow, but you also, to start out with, need to even have a budget. And I'm going to talk about that in a little bit. We also need to take a look at the money that is coming in and accounts receivable. And what I also am learning is not everybody understands what that is. So I have an example to show you what accounts receivable is. And this really is particularly important to those of us that are billing insurance. The other thing is we need to learn how to ask for money, and that is not something that we learned in any of our schooling. So we're going to talk a little bit about that today. So when you're doing a budget, I'm assuming you have budgets at home, but when you're doing a budget for your practice, and particularly when starting out and also going forward, you want to be able to project your income. And a question that came up yesterday was, how do you really do this? Well, in the beginning, you're kind of guessing at where you're going to be at a certain time in your business. But as you have already started your business, you have patients coming in, you have an idea of how many patients you're seeing on a regular basis, what your reimbursements on. So you can kind of have that projected income. And then you can also look at what your expenses are, and you want them all to meet. Or what you really want is you want the income to exceed your expenses. You want to be able to plan for growth. You want to be able to plan for if there's a certain item that you want to purchase, a large item. One of the key things that I am finding with people, for all of us, is to make sure that we are planning for all those tax dates that come up, because we don't want to mess with the IRS. We want to make sure that we have our projected or estimated taxes paid on time, because the penalties are just way too much to deal with. Your accountant should be able to help you with that. Ask your accountant a lot of questions around this, because what I find is not all accountants are equal. So you want to make sure that you query them about if you're in the right tax structure for your taxes, so that you can have the maximum allowed savings. You want to make sure that you have money going aside for those kinds of things. In addition to that, you certainly want to be paying attention to your own needs, making sure your practice and your business are protected when you're doing your budgets. Now, when we look at financial statements, some of the ones that are really, really important will be your profit and loss and your cash flow statement. Now, when I talk about the cash flow statement, let me go back here, sorry about that. When I talk about the cash flow statement, I want you to pay particularly important attention to that, because cash flow is the #1 reasons that businesses fail. And it's not just in healthcare, it's in all businesses. So people just don't have enough money to keep going. So you want to keep track of that. And when you pull that down from, let's assume you're using QuickBooks, you'll be able to get a good idea of if your cash flow is starting to decrease or what's going on with that. When you look at a profit and loss, you look at your profit and loss over a time period, and you can see whether you're having more of, if your income is going up or it's going down, if your expenses are going up or going down. You want to be measuring that from month to month, and then also from, like January of this year to January of next year, to see where you are. These are things, again, you want to look at on a monthly basis just to see where you are. Don't just look at your bank balance. Now, what about billing? This is everybody's big headache. Whether you send your billing out or whether you are doing your billing in-house, you want to take a good look at what's working and what's not. You need to have a pretty good idea of what to expect, so that you can also pay attention to whoever's doing your billing. Are they doing a good job, or are things getting lost? It is not unheard of for an angry biller to hide claims in a drawer, for instance, and not send them out, or for people just not following up on the bills, not getting them out. It's not uncommon for people to skim money off the top. You want to make sure that you are monitoring this stuff. You want to see what money is being left on the table. Are you actually coding appropriately for the work that you do? I would never want to suggest that you upcode, but what happens is most of us downcode. And what I mean by that is that we're not coding for the appropriate level of service. There's this myth out there that we can never code a 99213 or a 99214 for an office visit because we'll get audited. But the truth is if your level of service and your documentation shows that level of service, that it is a 99214 or higher, you certainly should be billing that out. Not doing so, you're leaving money on the table. Let's see. Sorry, I see a little interruption there. There we go. And then what money are you not receiving? Not only from your third-party payers, but from your patients. Do you know how to collect money from your patients? Your patients have a contractual obligation with their insurance companies to pay you a certain amount. They have to pay a certain amount out of pocket to you. You have a contractual obligation with the insurance company that you have a contract with to accept that money. And so, are you getting what you should be receiving? Interestingly enough, not everybody understands these terms, and I just want to go over them for a moment here. Our patients certainly don't always understand their insurances, and I think that we need to actually take some time to educate them, but we also need to educate our staff and ourselves. One of the things that I've been recommending is that you can go to I think it's healthglossary.gov or something along those orders. Sorry, I don't remember the link off the top of my head, but you can Google it. And you can actually get a whole list of insurance-related terms that you can use for your patients. I recommend that you put them on your website, but you also educate yourself and your staff. So when we have money, when we look at the allowable amounts that, whether it's Medicare, Medicaid, whether it's Blue Cross, whoever it is, what they allow us, that's the total amount right there. And out of that, the patient has a copay that they have to pay at the time of service. They also have a co-insurance, which means that perhaps the insurance company is going to pay 80% of that allowable after the copay to the provider, and then the patient pays that other 20%. And those numbers vary because in some cases it might be a 50% coinsurance. You don't know. You have to look at each individual plan. And then everybody, including Medicare, has a deductible, which means that that amount of money has to be paid out of pocket before the insurance will even kick in. And this is particularly important today because so many of our patients and our clients have high deductible healthcare plans. And so with those high deductible healthcare plans that might be at $700 or $7,500 or even up to $10,000, these folks are going to be essentially cash patients. And so you're going to want to collect that money as the ARs come in and at the time of service, depending on how it is set up with them. Not doing so and waiting for your money later and to bill your money is a way, number one, your chances of not ever getting paid increase, and number two, it's going to cost you more in the end. So you really want to stay on top of this. So accounts receivable. Accounts receivable is actually money that is owed to you for work that you've already done. And when you look at whatever billing platform that you are using, whatever accounting software with your billing platform, you can actually pull a report that'll break it down into different buckets. And so you'll have 0 to 30 days, 31 to 60 days, 61 to 90 days, 91 to 120 days, and then above 120 days. Now those numbers may be a little bit different depending on which platform you're using, but those are the standard buckets that are used. As I said a little bit ago, the farther that money, or the farther out that money is, so like above 120 days, that's 4 months. It's going to be hard for you to start collecting that money as you go forward because, and as we kind of talked about in a workshop that I did yesterday, you know, there's a subset of population in our country that does feel that all healthcare should be free. And some of us may even feel that way. And so that somebody else should be paying and I shouldn't have to pay. And wherever you are on that, you're still going to have 1 or 2 patients that are feeling that way. And if you are not collecting money that is due to you, you will not be able to sustain your practice. You've got to have that cash flow. You've got to have enough money. And you have an obligation to your patients, to your staff, to your community, and to yourself and your family to be collecting that money. Here's an example of what an AR might look like. And if you notice, we've got our different buckets, and it goes for greater than 121 days. And it's broken out into whether it's patients or it's insurance, and then what the percentages are. And if you see in the early part, so that's 0 to 30 days, down at the bottom there, it says 60%. So there's 60% of the money that is outstanding in 0 to 30 days. That's fine. Most of that should be taken care of and dropped down in that 31 to 60 days. And you can see here, you still have 25% outstanding, 27% from patients, 25% from the insurance companies. And that number should get lower and lower and lower over time, so that you can see here that at 121 days and greater, that it's just down to a total between patients and insurance of 2% that is outstanding. And that, in many cases, is probably going to end up being bad debt that is just not going to get paid. So why do you have this money still outstanding? Well, first of all, insurances don't pay on everything. It may be that there was a problem with the claim. Maybe the person really didn't have insurance. Maybe what you're trying to bill for is not a covered service, that kind of thing. And then when you have patient balances that are left, maybe they're paying it, maybe they're not. I think we've all had the experience of a patient going into bankruptcy and not being able to pay their medical bills. So let's talk about marketing. So when I talk about marketing, and I probably mentioned this in the last part that we did, is I look at marketing as education, because none of us really likes this whole idea of selling or anything. But what we're doing is we're educating our patients on the things that we want them to do on a daily basis. Well, this is going to be the same thing about why people should come into our practice. And it's really important that we're always bringing people into our practice. We want to know where they come from. And this is something that you should be asking all of your new patients, because that will give you a clue on where they're coming from and where you should put your marketing efforts. You will always have patients leave you. They die, they move away, they want a different provider. Maybe they can't afford to see you anymore. But we always lose patients to attrition, and that is, it's like a golden rule with that. So you always want new people coming in so that you will always have that practice that has enough patients to help you sustain what you're doing. One of the questions that recently came up is, well, if we're moving to a value-based care, is this still really important? And yes, it is still really important. You still need to have those patients coming in, because this is your product, this is your service, and if you are not providing a product or service, then you will not have the revenue to follow. One of the things that is really important, and regardless whether you are in your own practice or not, I believe every single nurse practitioner out there should have their own website. If nothing else, have a professional profile on it. And then you want to get listed. So for our practices, or whether we're marketing ourselves as an expert or whatever it is, these are places that you can list your website, your business, your service for free and help you get found. There's a lot of different marketing venues out there, which we went through last time, but this is something I think that everybody needs to do. So you can get yourself listed in Google, And I'm sure you've heard SEO and organic searches and this kind of stuff. Well, this goes a little bit beyond it. When you do a Google search, I'm sure all of you have seen the maps that come up at the very top of Google with certain businesses listed in there. This is how you get to the top page in there in the maps. So you can go to the website that's listed here, google.com/business, and get yourself verified and listed so that you're coming up at the top of the page. You want to do the same thing with Bing and Yahoo. While they're not searched nearly as often as Google, it's still important for you to have that. The other thing that comes up a whole heck of a lot is Yelp. And so you can get yourself listed on Yelp as well. And again, all of this is free, and it helps people find you. In my own practice currently, I've done all of these things, plus a few other things, and I consistently now come up on the first page of Google, even with my website. So this is a way to help you get found. Many times these days, people don't go beyond that first, second page of Google. They're just looking here to see who they can find. And when you come up first, that's where they're going to go. So that's something that you definitely want to be doing when you're marketing your practice. Let's talk about social media for a moment. There's a couple of things I want to say about social media. And this actually goes into the rating sites that are out there. It is really important how you conduct yourself on social media. Everything that is on social media is there forever, just like anything else online. It's also anything that you put in social media is discoverable should a legal issue come up. So you want to be careful about what you're putting on social media. I do believe that you want to have a business presence on social media for your business. So it's going to depend where your patients hang out. But I personally feel everybody should have a Facebook page where you can share information, health observances, or maybe something that's happening in your practice, or you want to remind people that you're having a special sports physical clinic or whatever it is. It's a way to attract new patients to your practice. It's a way to help you get found because Facebook comes up in the search engines as well. So that's another way for you to get found. But I want to caution you about what you're putting on social media. And because it's also come up recently, I would also caution you to make sure that you are practicing within your scope of practice and that you're practicing ethical healthcare and that you're really looking at your evidence base, because those are concerns that have been expressed to me by some of the regulatory folks out there. So I'll just throw that out there, which actually takes us right into compliance. And compliance just means staying legal, basically. And so when we talk about compliance, this can by itself be probably a whole day seminar because there's so many different moving parts. But some of the most important for those of us in business, in addition to just staying in compliant with our certifications and our licensure and our scope of practice for our state, will be some of these areas here. So OSHA is one. If you have any employees at all, even just one employee, you are required to have an OSHA program. The biggest one for you and I is going to be bloodborne pathogens, but there's some others that are involved as well that are particularly applicable to healthcare practices. And the website link that I have listed here, the OSHA, will take you to the clinicians, and they will go through some of the different areas that you need to consider. Now, it's not all of it's going to be appropriate for everybody. For instance, in a primary care clinic, you may or may not have to do anything with radiation because you may not have x-ray. But if you're urgent care and you happen to have an on-site x-ray, then you're going to have some more of the protections there for your workers. And that's what OSHA is all about. I think everybody knows at this point about HIPAA and some of those privacy issues and the data breaches and these kinds of things. So you definitely want to make sure that you have a strong program in that. And Health and Human Services has an excellent training program that you can get all of the information you need. The one thing I want to caution you about is you need to do the security risk assessment that they have on there, and whatever you find, you must fix. If they audit you and tell you you've got to fix these things, and then they come back and you didn't, you'll certainly have a lot of problems with that. HIPAA breaches, data breaches, ransom, this kind of stuff, there's so much out there. One of the things that you may want to consider, which I haven't really included in here, but you may want to consider is when you are looking at business insurance, you may want some kind of data insurance as well that will help you in case there is a data breach or HIPAA breach. The Office of Inspector General is charged with monitoring for fraud. And they also have an excellent compliance training that will talk to you about Stark, and it'll talk to you about anti-kickback and false claims and those kinds of things. And I get people saying, well, it says Stark. We don't have to worry about Stark. Regardless of whether nurse practitioners are listed in Stark or not, I think that we need to be paying attention to exactly what it's there, because frankly, I wouldn't want to break Stark just because I'm not a physician. So you really do want to follow those things, and you do get CE credits for going through that particular training program. And again, if you have employees, there's a whole lot of laws on a state and a federal level that you need to be in compliance with if you have employees. And you can have a lot of fines with any of these things by not staying in compliance with these. So you want to make sure that you have all the policies and procedures for all of these different areas in your practice. You want to make sure that your training is up to date. So we have to train our staff in HIPAA. We have to train our staff in OSHA things. We have to, if we have staff, we have to look at hepatitis B vaccines and all the rest of it. So you want to make sure that you have the policies and procedures, you've done the training, you do the annual updates, and making sure everything is documented so that you are protected in that area. Let's talk about self-care for a few minutes before we start taking questions here. This is not an area that we generally talk a lot about, and I think it's really important. I see a lot of articles, a lot of discussion about burnout recently, about physician suicide. I haven't seen it about nurse practitioner suicide, so I really don't know if we have numbers on that. But these are issues. As healthcare providers, every single one of you is under a great deal of stress. It's hard work that we do, and sometimes it may feel as if the rewards aren't coming forth as often as we would want. You not only have all of your patients that you're trying to take care of, but you may have staff, you may have family, you've got all these regulatory bodies that want you to do things. And it's really, and we're professional caregivers. And for many of us, and the majority of us also being women, we weren't really ever taught to take care of ourselves first. And yet that is one of the things that we need to do most often, is to take care of ourselves first. And so that's why I want to talk about that. Now, just as a brief review, and I think all of you know this, and I hope you can read this well, but the effects of stress, they're varied. We know that they can affect us emotionally, they can affect us spiritually, they can affect us physically. We're now seeing research come out talking about how stress can increase our risk of dementia, which a lot of us that are baby boomers are very concerned about, because these effects can be cumulative over time. So if you look here, you things like under the physical, you know, the headache, muscle tension, chest pain, fatigue, you know, libido, that's not going to help us at home, is it? GI upset, sleep issues, all of these kinds of things come under the physical effects of stress. And then in mood, the restlessness, anxiety, feeling overwhelmed. I know just in talking with people, just the fact of being in practice and having to deal with an EMR is particularly stressful, and it makes people irritable and angry. And sometimes people are just fed up with it all. And then you have the whole idea of the angry outbursts. We do have drug and alcohol issues within our profession. You know, why is that? Tobacco use, we still have issues with that. Withdrawal, and maybe not exercising as often enough as we need to. And I think that these are all issues, and these are all shown to be related to stress. So what is it that we can do with ourselves in order to feel better and to mitigate some of the effects of the stress that we have just from the work we do? And, you know, the other thing about this is if we are not taking care of ourselves, we cannot take really good care of our patients, our staff, our business, our communities, our families. And so self-care is just really important. So maintaining energy, maintaining our cognitive ability, taking care of ourselves makes us a role model for those that are around us. And it certainly can avoid compassion fatigue and burnout. And so many nurse practitioners that I've talked to, they've gone down this road of being just tired of taking care of everybody else, being burned out, and looking for other things to do. I've been there myself. And you just, you know, fortunately in nursing, we can pivot a little bit and we can start anew, but we have to take time out for ourselves. So what is it that we can do? One of the most important things that I know many of you do, because I know a lot of nurse practitioners and nurses do yoga. That's not something that I had ever gotten into, but since doing more with hypnosis and hypnotherapy, I've learned how important just taking a deep breath can be and letting that relaxation wash over you. Mindfulness, and there's a lot of people that have talked about mindfulness, and there's a lot of courses that we can take about mindfulness. Mindfulness is basically just being in the present and not worrying about the past, not worrying about the future, but just being in the present, which is really all we have if you think about it. Meditation. And when I learned about meditation, I've tried it many times, and I've always thought that I have failed because it's like you're supposed to have a quiet mind. How do you have a quiet mind? Well, I've since learned your mind doesn't need to be quiet when you're meditating. You will still get a lot of those effects. I find the self-hypnosis and guided imagery to be particularly helpful for me, and I've heard that it's helpful when I've talked with other people about this. Getting out, taking that daily walk or any other exercise. One of the things that I have often visualized myself when I'm walking, it's like with every step I'm leaving some of the stress behind. So that's something you can do. We can get a coach or a therapist to work with if we're particularly fatigued or stressed or burned out. And doing so early is taking care of ourselves so that we're able to take care of the other people. And then the other thing, as Americans, we don't ever take time off. Just looking at the statistics, you know, we tend to work. Now, I know that a lot of us will take and use our vacation time maybe to go to a conference, which is great because conferences oftentimes are in nice places, but are you really taking the time off? Not if you're sitting in a class all day or you're going from workshop to workshop. So you do want to think about actually just taking time off. And I would say taking time off these days, it also means turning off all of our electronic devices. And so I do want to encourage everyone to just, you know, take some deep breaths, take some time off, turn off our computers, make sure we're getting plenty of sleep, plenty of rest, and just really taking care of ourselves. And it's okay to be number one and not number last. So I just want to thank you for letting me give you some of the information that I have, as well as some of my thoughts. Here's my contact information, and we can certainly go ahead and take questions because I know we have plenty of them.
Yes, we always do, Barbara. Thank you so much. Another great presentation on NP practice. I particularly like the fact that you're talking about self-care. I think in our society of healthcare givers, we often forget about that piece, and that is so much a part of what makes us better providers. So thank you so much for bringing that up. We are at this time and have been throughout the presentation taking questions. So if you have not already done so, please submit your questions here through the GoToWebinar panel where it says questions. And we will go ahead and get started on the first few questions. So the first question, Barbara, this is a person that owns a geriatric consulting business. She does home assessments, including safety, nutrition, fall screens, goal planning, medication review, family discussions, care coordination. That's a lot. And I'm curious if anyone is aware of insurance companies in any part of the country that pay for these types of services or express an interest in this prevention for high-risk patients. Or are you aware of any insurance companies that would reimburse for these services?
You know, off the top of my head, what I'd need to do, number one, is really take a look at how you would code these things and what kind of services they would come under. I mean, certainly we have preventative care that would come under some of that, but beyond that, I would have to just really look at that and look at some of the codes that we could come up with.
Okay, and I'm assuming also, Barbara, that's something, I know you have a blog as well where you take questions and you entertain, you know, information from others about this, so this person could also go to your blog and they could, you know, put that question in there as well.
Yes, yes.
Another question, any recommendations for quality web design companies that could help create a marketing website?
Oh, you know, there's a gazillion people out there that will tell you that they will design a website for you. And so I don't have anybody in particular that I would recommend. I've always done my own. But one of the things that the platform that I particularly like, it has been WordPress and the self-hosted WordPress. If somebody wants to do it themselves and they're really not technically inclined at all, it can still be done. They can use something like Weebly or Wix to get started with. But again, I think taking a look at WordPress, if you have at all anything technical, or the other thing would be you can put out a job and have it bidded out at a place called Upwork.com. These are all freelancers. They're from all over the world. You can say, this is what I'm looking for. I would just be careful in how you go. Just really do your research on the different people that will reply to you. But yeah, Upwork.com is one place you can go.
So was that UPWORK?
Correct.
Okay, .com.
Mm-hmm.
Okay, just wanted to be sure. Another question coming in, my doctor and I want to start putting in, I believe this is IUDs, in our primary care office. We're going to be going to classes to learn. How would I know if my family nurse practitioner license in Florida covers that? The scope of the practice is not specific for IUDS.
I would talk, well, anytime you have a question about scope of practice for your state, contact your Board of Nursing. And in most boards, they will have somebody who is the expert person there on NP practice. And so I would query that person about what is covered or not for your particular state.
Okay, great. This is a question not so much about practice, but I know that you've had you get lots of questions about this in terms of starting your own practice. So this is someone who's asking for help in landing their first job, and is just mentioning that it's very difficult in Florida. Jobs require a minimum of 1 year experience. I mean, to be fair, I think it's not just Florida. I think it's many states require at least 1 year experience. So maybe you could talk a little bit about that in the context of if and when you should open up your own practice.
So, okay, one of the things I would say in terms of trying to get some experience, because this actually came up in the workshop we were doing yesterday. There was a nurse practitioner who actually just started working with somebody else, even shadowing that person for a while and picking up some of the parts so that you can actually go and volunteer and see if you can get some hours that way, or even volunteer at a free clinic or that sort of thing. In terms of starting your own practice, I do feel that a nurse practitioner should be able to stand on his or her own, not having to rely on looking up absolutely everything. I think our clinical legs need to be pretty darn strong before we step out and try and start our own business, because there are so many other moving parts. It's and yeah, that's what I would say for the most part. There's always little exceptions to the rules, but for the majority of us, as a new clinician, I just don't recommend that we go out and do this. Now, whether that takes 2 years, 3 years, 4 years, that's an individual thing.
Great, thank you. And just in terms of, new practices, I would second that as well, and finding a job, and really look back into your resume to anything that you may have done, even shadowing in a school or shadowing in places, or maybe even starting with some part-time work where you can get some, medical care kind of under your belt. But that first year is a tough one. A question about when you have employees that work for you. So if you have an employee that's working only part-time, do they need to have compliance training or other training?
Yes. So even a part-time employee, we're talking employee, not independent contractors, but employee, they're on your payroll. They're part of your staff. They have to have gone through all the different compliance training that is out there. You would have had to have gone through and made sure that they have had the bloodborne pathogen, that they have had their hepatitis B vaccine, and you have to, part of OSHA is we have to offer that to people that we employ that are not, haven't had it before.
Great, thank you. So while this is not so much about today's presentation, there is a question about starting a practice. And I know that you covered this in both part 1 and part 2, so I would encourage the person that asked this to go back and listen to the Vimeo recorded part 1, part 2. But the question is, and maybe you can just go over this briefly. So do you start as an LLC, working with a lawyer, finding a property? I guess, what are some first initial steps, including developing a business plan, that there's someone who be interested in a startup and kind of wondering how to get that going?
The first thing I think that definitely go back to that very first video, because that was what we spent that whole time talking about on those first steps. So the first steps are, basically, are you really ready to do this? Do you have the time? Do you have the energy? to be able to do this. And then sit down and do some research on paper. Figure out what it is that you want to do, what it's going to cost, where you're going to get the money. Look at all of your different options. Don't even worry about whether it's an LLC or a PLLC or any of that kind of stuff in the beginning. Start planning out just what is it you want to do, how much is it going to cost you, and of course these are guesstimates. You know, what kind of revenue you're going to get, what kind of business models might you want to look at. And then when you're looking at the different kinds of business structures, some of that's going to be state dependent. In some states, as a professional, you cannot start an LLC. It has to be a professional LLC or a professional corporation. So you just need to look at your state laws on that. The other thing I would say is talk to a CPA. Talk to a CPA, because you've got to know where you're standing financially, tax-wise. They can also give you some advice on which corporate structure might be a little bit more important. But planning out, doing your research, making that plan is the best place to start.
Here's an easy one, I'm hoping. What's a reasonable percentage rate for accounts receivable over 120 days? Obviously, 0 would be best, but not likely.
Absolutely. You want to be that. To me, it's not acceptable at all to have it over 120 days, because that's money that chances are you're not going to be seeing. I believe I read somewhere that one of the benchmarks, I think it was MGMA that put this out, that it was somewhere like around 4%. But I think that's too high. You know, obviously that's not what you want at 120 days.
Right. People are also asking questions about getting a coder. So do you recommend hiring someone? Should you learn how to do the coding? And how do you approach the coding and billing aspect? Or how
Yeah, so you have look at, I think when we're in business, one of the things that we need to look at, the more that you are paying for different services, the less money is going to be in your pocket. And so do you need a coder for a primary care practice, for an internal medicine practice? I think not in most cases. You know, I think the coding really gets complicated when you start looking at practices that are doing a lot of complicated procedures. Maybe they're doing multiple procedures, like in a surgery office or that kind of thing. So, but a basic primary care type office, I don't think we need to necessarily have a coder. And I think we need to learn how to do our own charts and to code our own visits. And there's one place that I usually recommend to learn how to do some basic documentation and coding. First of all, is going to be, I hope you had learned it in school, but your state organizations. I believe AANP also has a class every year. EM University is another place to be looking at. And just watch online for there's various continuing education classes around learning how to code your visits. That's where I think people need to focus on, is learning how to code your own visits and not relying necessarily on somebody else.
There's a question that came up about educational background, and do you need or would you recommend an MBA before opening up a practice?
Most MBA programs that I am aware of, although that's changed a little bit, but most of them are not geared toward entrepreneurial type of startups. So I don't think we need to have an MBA in order to do business. And I would venture to say that most people do not have an MBA that have their own business.
Okay. I'm in a practice that is growing. How do I recruit in other NPs?
That's a really good question. I think the first thing that you need to look at is, what is it that you want in that NP, and what do you have to offer that NP? And then just start the whole recruiting process. You can do that in your local community. You can do that on a statewide level, you can certainly advertise. Social media is a great place to be looking for jobs. I wouldn't necessarily go and hire like a headhunter at this point, unless you are at such a level that you do have the resources to be able to pay that headhunter, as well as bring that nurse practitioner in. I know with a lot of, we're really short of nurses, for instance, and nurse practitioners, it seems, because I'm seeing a lot of sign-on bonuses right now for people going into different places. But I would start in my local community and see, that word of mouth. That's a good place to start.
Great, thank you. There was a question about the use of telemedicine and private practice and starting your own practice. Could you speak to that for a minute about the feasibility of that, or if that's being done somewhere else?
That's one of the biggest areas of growth that I see right now, is everybody wants to get into telemedicine. I think what you need to be aware of, first of all, is if you're going to do that locally, or if you want to do it across state lines. Because right now, if you want to do it across state lines, you do have to have a license to do that, a license to practice in each of those states that you might have clients in. So if you don't have clients outside of your state, or excuse me, if you don't have a license outside of your state, you can't see any of those clients. The next thing to consider is, which of the payers are you planning on looking at? Medicare has a lot of regulations about what's appropriate, where people can go, and that sort of thing. So look at who your clientele, your patients are going to be, and whether you're trying to do it in-state or out-of-state. But a lot of practices are adding this to their repertoire, and I think that we're going to see more and more of it, because for a lot of people, it's so simple to do, and a lot of people like the convenience. If I don't have to come back in to see you, but I can just do something on video with you, I'm there, as are a lot of other people. So.
We have time for maybe a couple more questions. There have been a lot of questions. I'm going to try to hit some of the highlights here. So back to accounts receivable.
Yes.
So on accounts receivable slide, there was a 60% of income outstanding within 30 days. At what percentage do you feel that there's a cutoff, generally speaking, when the business is getting into trouble?
And as far as that first that first 60 days, I think, in many cases, that first 0 to 30 days, first of all, you may not just get reimbursed within that 30-day period of time. Some insurance companies say, yes, we'll reimburse you in a week or 2 weeks, but it's going to take a little bit of time. And also, by the time that you get that EOB, ERA from your payer, and then you send that statement out to the patient so that they can do their pay their portion of it, you're really going to get over that 30-day period. But by 60 days, you should see that starting to fall down. And the thing is if you're seeing claims that are not being paid on a regular basis, somebody in your office needs to always be looking at that AR. How long has this been outstanding? What kind of delays are we getting? You also want to look at who are your slow payers. Somebody just may be a slow payer. Maybe they're getting too slow. And at that point, maybe you want to reevaluate how much do you want to work with them as well.
One last question. There's a lot of questions about payers. So, it's come up in New York, Mississippi, Nevada. People are asking, how do you know who would be friendly to NPs? So who's going to recognize us at private payers as primary care providers? How do you find out who those payers may be so you can court them for your practice? For me, I never know. So I'm hearing a lot right now from people that are hearing from like Blue Cross Blue Shield that they are not credentialing nurse practitioners, or they're not, or different companies that are not going to credential nurse practitioners if their collaborating physician isn't credentialed, or they're saying we aren't accepting any new nurse practitioners. And yet
a lot of the insurance companies that people are talking about, and this is all over the country, those are all companies that I have no problem getting credentialed with in Washington State. So I think there's some geographical differences. There may or may not be some truth to some of them. I also personally feel that maybe we're getting into, because this seems to be increasing, or at least I'm hearing about it more, I wonder if we're getting a little bit of a pushback. So I don't know. I would say what I would do is I would take a look at all of the insurance companies in my area. Where are my patients coming from? What kind of insurances do they have? If I'm in a town that has a major university system and that's what the major employer, I certainly want to go after that insurance. Whether they're going to be friendly to me or not, I don't know until I go and try.
Right. Thank you so much. We are out of time. It was an excellent presentation, as always. I really thank you for that. We have a slide up here now. Should you have any additional questions about the Transforming Clinical Practice Initiative and the work that's going on with CMS, please feel free to contact myself, Cheryl Fatabene. My email is there, or Tiffany at the NNCC. We are here for nurse-led care and here to support you. There's a link at the bottom as well that gives you information about training opportunities through the NNCC. Most of what we do here is free, so please check out that link. And then next month, we will be doing a presentation on transition and turnover, and this is a doctoral research study that was done on first-year NPs out in practice. So please join us for that if you can. Again, thank you for your time, everyone. We appreciate you being with us today, and we will hopefully see you next month. And thanks again to Barbara Phillips for her expertise.
Thanks for having me.
All righty. Thank you, everybody. Bye-bye.